Hello and welcome to the Bureau of Community and Health Systems video presentation on how to prevent falls. We hope you find this information helpful. Today we will be discussing causes of falls, fall prevention, and what to do if a fall occurs. Let's first go over some fast facts about falls. Falls are the most common cause of injury visits to the emergency room for older adults. Most falls happen in the home, approximately 60%. Falls cause more open wounds, fractures, and brain injuries than any other cause. People with mild hearing loss are nearly 3 times as likely to fall. Next, let's discuss some of the different causes of resident falls. One of the causes of falls is poor eyes, poor hearing, or poor reflexes. Conditions such as diabetes, heart disease, arthritis, or problems with thyroid, nerves, feet, or blood vessels can also affect your balance and lead to a fall. Conditions that cause rushed movements, such as incontinence, may also increase the risk for falling. Adults with mild cognitive impairment or certain types of dementia are at a higher risk for falling. Blood pressure dropping too much when going from laying down or sitting to standing up can also lead to a fall. Foot problems and unsafe footwear. High heels, floppy slippers, and shoes with slick soles can make residents slip, stumble, and fall. Medications that have side effects of dizziness or confusion can increase a resident's risk of falling. The more medications a resident takes, the more likely they are to fall. Safety hazards in the home or community can also cause falls. Age-related loss of muscle mass, known as sarcopenia, is a fall risk factor. Problems with balance and gait are also fall risk factors. Psychoactive medications including anticonvulsants, antidepressants, antipsychotics, benzodiazepines, opioids, and sedative hypnotics can lead to falls. Prescription drugs, over-the-counter medications, and herbal supplements can cause dizziness, sedation, confusion, blurred vision, or orthostatic hypertension, which may lead to an increased risk for falling. Next, let's discuss how falls can be prevented. Exercise that improves balance and strength is important for residents to engage in. Lack of exercise can lead to weakness and increases the chances of falling. With the healthcare providers okay, encourage the resident to do exercises to make their legs stronger and improve balance. Make sure residents get enough sleep. If a resident is tired, they are more likely to fall. Encourage the resident to avoid or limit alcohol. Too much alcohol can lead to balance problems and falls. Have residents stand up slowly. Getting up too quickly can cause blood pressure to drop and can make a resident feel wobbly. Have the resident keep their hands free. Use a bag or backpack to carry items and keep hands free. Encourage the resident to consider staying inside when the weather is bad. If the resident needs help feeling steady when walking, make sure they're using an assistive device. Make sure the assistive device is in the resident's written assessment plan and agreed upon by the resident and the resident's designated representative and the licensee. Have the resident take caution when walking on wet or icy surfaces. Remove clutter and tripping hazards in the home. This includes removing boxes, newspapers, and electrical cords from walkways. Move coffee tables from high traffic areas and secure loose rugs. Clean up spilled liquids immediately. Add lights to the home. As residents get older, brighter lights are needed in order to see well. Put a seat in the bedroom for residents to sit in while getting dressed. Add support in the bathroom, like a shower seat, grab bar, and adjustable height shower head. Keep frequently used items between waist and shoulder height for easier access for residents. If a resident falls, tell their healthcare provider right away. Speak openly with their healthcare provider about fall risks and prevention. Once a year, have each resident's eyes checked. Poor vision can increase the chances of falling. Also have their feet checked once a year. Discuss proper footwear with the provider and ask whether seeing a foot specialist is advised. Ask the resident's doctor about health conditions that increase risk of falling. Certain eye and ear disorders may increase risks of falls. Use the checklist found on this slide to find and fix hazards in the home. You can find a link to this checklist in the information box below this video. Have your resident's healthcare provider review all the medications the resident takes, including over-the-counter medications. Talk openly with the resident's physician regarding fall risk and prevention. The following are some questions that should be asked of the resident's physician regarding medications. Why are the medications prescribed? How long before the medication should be helping? What side effects to watch for? How much medication and when is the medication taken? If side effects have been experienced, are there alternative medication options? Should medication be taken with food? Can any medications be eliminated? If a resident falls, have the resident breathe and remain still on the ground to get over the shock of falling. Have the resident decide if they are hurt. Getting up too quickly can make the injury worse. Have the resident crawl to a sturdy chair if able. If the resident thinks they can get up safely without help, have them roll over onto their side. Rest again while their body and blood pressure adjust. Then have the resident slowly get up on their hands and knees and crawl to a sturdy chair. Have the resident slowly sit down on the chair if able. Have the resident put their hands on the chair seat and slide one foot forward so that it's flat on the floor. Keep the other leg bent so the knee is on the floor. From this kneeling position, have the resident slowly rise and turn their body to sit in the chair. Get help, call 911. On this slide, we have provided you with some resources to learn more about falls and how to prevent them. Thank you for watching our video presentation on resident fall prevention. We hope you found this information helpful. As always, resident safety is our #1 priority.